Right now, somewhere in this country, a family is standing in a kitchen at 2 a.m. because grandma can't remember the code to her own front door. Not a new door, not a stranger's house, the same door she's walked through for 31 years. 11 months earlier, she was still doing the crossword every single morning before her coffee finished brewing. Sharp, funny, the one who remembered everyone's birthday without checking her phone. Then it started small. A missed appointment here. A pot left on the stove there. Her daughter chalked it up to age. Everyone did, until the night she got lost 4 blocks from her own house, in a neighborhood she'd lived in since 1991. Here's the detail nobody in that family thought to mention to the neurologist. 8 months before any of this started, her regular doctor had added a new pill to her nightly routine. A small one, an unremarkable one, the kind you'd never suspect because it wasn't for her brain at all. I'm Dr. Marcus Wells, and in almost 2 decades of practice, I have sat across from more families than I can count who are living some version of this exact story. And here's the part that keeps me up at night. Some of what looks like rapid dementia, the kind that seems to arrive overnight and steal a person in months instead of years, isn't always the disease itself. Sometimes it's sitting in the medicine cabinet, prescribed, refilled, trusted. Today I'm walking you through 9 common pills that research has linked to accelerated cognitive decline in older adults. Not rare pills, not exotic ones. The ones sitting in your bathroom right now, or your parents', or your spouse's. I'm counting them down, and I need you to stay through to the end, because number 1 on this list isn't a single medication at all. It's a hidden multiplier effect almost no doctor calculates during a routine visit, and it may be the most reversible cause of memory loss in this entire video. Before we get into it, tell me in the comments how old you are and list the medications you take every single day. I read every comment, and it genuinely shapes what I cover in future videos for people exactly like you. Let's start at number 9, and don't let the low number fool you, because this one is sitting in almost every home in America right now. Number 9 is diphenhydramine. You know it by its shelf name, Benadryl. The little pink pill people reach for to fall asleep, calm an allergy, or take the edge off a cold. No prescription required. Sits right there next to the aspirin. And because nobody needs a doctor's permission to buy it, most people assume it's gentle. Inside an aging brain, it behaves very differently. Diphenhydramine blocks a chemical messenger called acetylcholine. Think of it as the brain's internal mail carrier, delivering the signals that let you form a new memory and stay alert through your day. Aging brains already produce less of this mail carrier. Block what little is left, and the delivery system starts dropping packages. The part of the brain that takes the hardest hit is the hippocampus, the small structure shaped almost like a seahorse, where new memories get filed before they're stored long-term. Research published in the Journal of Geriatric Cognitive Health followed older adults using this type of medication regularly and found their risk of developing dementia over the following years was notably higher than those who avoided it. Not proof of a straight line from pill to disease, but a pattern serious enough that geriatric specialists now flag it directly. Here's your move tonight, and it costs nothing. Go check anything labeled PM, nighttime, or allergy relief in your cabinet. Read the active ingredient. If it says diphenhydramine, that's worth a conversation with your doctor about second-generation antihistamines like loratadine, which don't cross into brain tissue the same way. Never stop a medication on your own. Bring the bottle to your next appointment instead. That's number 9. Number 8 is one your stomach thanks you for, and your brain quietly pays for later. Number 8 is the proton pump inhibitor family. Omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. Handed out for heartburn and reflux, and people stay on them for years because the second they stop, the burning comes roaring back. So it feels indispensable. Here's what rarely gets explained at the pharmacy counter. Stomach acid isn't just uncomfortable, it's how your body pulls vitamin B12 out of food. B12 protects the insulation around your nerves. Suppress acid production long enough, and B12 quietly drops, along with magnesium. Starve the brain of those, and you get confusion, misfiring, memory slips that can look almost identical to early dementia, when the real driver might be a nutrient your medication has been quietly blocking the whole time. A large study published in JAMA Neurology following over 73,000 adults aged 75 and up, found regular users of this drug class carried a meaningfully higher risk of dementia diagnosis than non-users. Researchers have also observed higher levels of amyloid protein, the sticky buildup associated with Alzheimer's, in long-term users. If you take one of these every single day, that's worth raising at your next visit. Many people can taper toward gentler options like famotidine, sold as Pepcid, or ask about the lowest effective dose for the shortest reasonable stretch, not a lifetime habit taken on autopilot. Number 7 is prescribed for something most people would rather whisper about than say out loud. Number 7 is oxybutynin, sold as Ditropan, given to seniors dealing with sudden, urgent bathroom trips that can reshape an entire day. The relief is real, but oxybutynin blocks that same acetylcholine mail carrier we just talked about, and it crosses into the brain with almost no resistance, settling right where memories are built. A study published in JAMA Internal Medicine tracked adults over 65 using strong anticholinergic medications like this one for more than a year, and found their dementia risk climbed sharply, high enough that researchers described it as one of the more concerning classes on record. And here's what troubles me most about it. Almost none of these patients were warned. They were told a pill would calm their bladder. Nobody mentioned it might be dimming something else at the same time. The fog gets blamed on birthdays. Well, you're getting older, the family says, while nobody traces it back to the orange bottle by the sink. If you take this medication and you've noticed your memory slipping lately, mention both symptoms together at your next appointment. Newer options like mirabegron work through a completely different pathway and don't touch acetylcholine at all. Number 6 might surprise you, because it's one of the most prescribed medications on the entire planet. Number 6 is high-potency statins, simvastatin and atorvastatin, sold as Zocor and Lipitor. Let me be clear before I say anything else. These drugs save lives, lowering heart attack and stroke risk for millions of people. This isn't an argument against them. It's the half of the conversation that often gets left out of a rushed 10-minute visit. Your brain is close to 60% fat, and it depends on cholesterol to build myelin, the insulation wrapped around every nerve fiber so signals travel cleanly. Push cholesterol down hard enough with a statin that crosses easily into brain tissue, and some researchers believe you may leave the brain short of raw material it actually needs. A study in Frontiers in Aging Neuroscience found adults over 70 on certain statins for more than 3 years showed a higher rate of mild cognitive impairment with steeper effects at higher doses. Pravastatin and rosuvastatin, by comparison, don't cross into brain tissue as easily and are generally viewed as gentler choices. If you've noticed fog creeping in since starting one of these, that's a conversation for your doctor, not a reason to quietly stop a medication protecting your heart on your own. Quick pause. If any of this is connecting dots for you, tap that like button right now. It genuinely helps this reach more families dealing with exactly this. And tell me in the comments how many prescriptions you're currently managing. All right, back to the countdown. Number 5 is the benzodiazepine family, lorazepam, sold as Ativan, diazepam, sold as Valium, alprazolam, sold as Xanax, prescribed constantly for anxiety and sleep. At first, they can feel like rescue. The racing thoughts slow. Sleep finally comes. A study published in the British Medical Journal followed more than 8,000 seniors for 6 years and found those using benzodiazepines for longer than 3 months carried a substantially elevated risk of Alzheimer's diagnosis. Longer-acting versions like diazepam appeared even more concerning, since they linger in fatty tissue, including brain tissue, far longer than people realize. Here's the cruel twist. Stop one of these suddenly, and anxiety can return worse than before, sometimes dangerously so. That's exactly why this is not a throw it out tonight fix. If you've been on one of these longer than a few weeks, work with your doctor on a gradual taper measured in weeks or months, not days. Ask about buspirone, or specialized talk therapy built specifically for insomnia. Both can restore calm without the same fog. Number 4 is a single medication doing 3 different jobs, and that's exactly why it slipped under the radar for so long. Number 4 is amitriptyline, sold as Elavil, an older antidepressant still prescribed today for nerve pain, sleep, even migraine prevention. Its versatility is precisely the problem. It's one of the strongest anticholinergic medications still in common use. A study published in JAMA Internal Medicine followed more than 3,400 adults over 65, and those with the heaviest cumulative exposure to drugs like this one, over a decade, carried a markedly higher risk of dementia. It doesn't even take a high dose. A small nightly pill for years can chip away at memory so gradually that nobody notices until real ground is already gone. For nerve pain, ask your doctor about duloxetine or gabapentin. For sleep, low-dose doxepin is considered gentler on this particular chemical pathway. Number 3 is the one I told you to watch for at the start of this video, because it's prescribed to millions for something that sounds almost gentle by comparison. Number 3 is paroxetine, sold as Paxil, one of the most common SSRI antidepressants, used for depression and anxiety alike. It looks modern, kinder than older psychiatric drugs. But here's the detail rarely mentioned in a standard visit. Paroxetine is the one SRI with meaningfully strong anticholinergic activity, setting it apart from cousins like sertraline and escitalopram. Research published in Frontiers in Psychiatry examined older adults across different SSRIs, and paroxetine users showed measurable decline in short-term memory and word recall within the first year, at a notably higher rate than those on other antidepressants in the same family. There's a painful irony sitting inside that finding. A pill meant to steady the mind may, over time, be wearing down the very clarity it was prescribed to protect. The American Geriatric Society has flagged this specific medication on its Beers list, a formal catalog of drugs considered worth extra caution in older adults. If you're on it, ask your doctor whether sertraline or escitalopram might serve you with less cognitive weight riding along. Number 2 is prescribed so quietly that many people taking it don't even realize what class of drug it belongs to. Number 2 is the antipsychotic family, quetiapine, sold as Seroquel, risperidone, and olanzapine, sold as Zyprexa. Built originally for schizophrenia and bipolar disorder, today, they're frequently used off-label in older adults for restlessness, sleep trouble, or agitation, often in the busiest, most stretched-thin care settings, where a calmer patient means a more manageable night. A study published in Lancet Healthy Longevity followed more than 25,000 older adults and found those given antipsychotics for behavioral symptoms showed significantly worse cognitive decline within a single year, even those with no prior dementia diagnosis. These medications suppress dopamine, which governs not just mood but focus and memory too. Families describe watching someone go quiet, flat, almost absent, grieving a person who is still physically in the room. If a loved one is on one of these, ask the prescribing doctor directly, why was it started, and is it still necessary today? Often, calmer routines, reduced noise, and better sleep management can accomplish the same thing without the chemical cost. And now, the one I promised you at the very start of this video. Number 1 isn't a single pill at all. It's the thing hiding underneath every story I've just told you. Number 1 is anticholinergic burden, the slow, silent stacking of several of these medications at once. Picture this scenario, because I've watched it play out more times than I can count in real families. A senior takes Benadryl every night for sleep, oxybutynin every day for the bladder, amitriptyline for nerve pain in the evenings. Individually, each one might produce a barely noticeable effect. Stacked together, day after day, year after year, the burden on the brain compounds in a way that no single prescription label ever warns you about, because no single doctor writing one of those 3 prescriptions is looking at the other 2. A study published in Age and Aging tracked more than 280,000 older adults and found those carrying the highest combined anticholinergic load had over double the dementia risk of those with the lowest load within 10 years. Double. And the overwhelming majority had no idea they were even carrying that load. Nobody had ever added it up for them. Here's the hopeful part, and it's exactly why I made this video today instead of something easier. When this kind of decline is caught early, it is often reversible. Reduce the burden, and many people report real gains in clarity within weeks to a few months. Not guaranteed, not instant, but documented often enough that geriatric specialists take it seriously. The brain, even an aging one, holds more capacity to recover than most people are ever told. So here is the zero-cost habit I want you to start tonight. A simple self-observation experiment, not a medical order. Take a notebook or open a note on your phone and write down every single thing you take. Every prescription, every over-the-counter pill, every supplement, every just-in-case bottle in the back of the cabinet. Beside each one, write down when you started it and why. That single piece of paper is worth more than almost anything else in this video, because it's the exact document your doctor or pharmacist needs to calculate your total anticholinergic burden using simple scoring tools already available in most clinics. Bring that list to your next appointment and ask one direct question. Can we review all of this together and see what my total burden looks like? That one sentence has opened more doors for my patients than almost anything else I've ever suggested. It doesn't cost $1. It doesn't require a new prescription. It requires 10 minutes and a willingness to ask. If you or someone you love is on 3 or more of the medications from this list, do not panic and do not stop anything tonight on your own. Some of these, especially the benzodiazepines, can be genuinely dangerous to stop abruptly. What you can do, starting this evening, is build that list. Start the conversation. Ask for the review. That's the whole plan, and it's the one thing almost nobody does until it's already gone too far. Now I want to hear from you. Of these 9, which ones are sitting in your cabinet right now? Have you or someone you love noticed fog creeping in after starting something new? Tell me below, and tell me you'll build that medication list this week. Someone reading the comments after you might be the family member who finally connects the dots. Before you go, there's one more early warning sign almost nobody checks, and it shows up months before memory problems ever become obvious to a doctor. It's a simple 6-word sentence test neurologists use in under 2 minutes, and I'm going to walk you through exactly how to try it on someone you love in my next video. Stay close to this channel for that one. I'm Dr. Marcus Wells. Take care of that mind of yours. It's the only one you get. This video is for general educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Never stop, start, or change any medication based on information from this video. Always consult your physician or pharmacist before making any changes to your treatment plan.